Pneumology. Underrated or overrated? And should you choose it? It wasn't even on my radar, but until I actually completed my rotations, they changed my mind. No one really thinks about it, but trust me, there's way more going on that you'd expect. If you think it's just all about COPD and inhalers, well, you're in for a surprise. In this series, I'm rating every specialty I rotate through, brutally honest, based on 6 criteria that actually matter. Those being work-life balance, procedures versus thinking, patient contact, teaching environment, cool factor and impact, and my personal enjoyment. Oh yeah, and stay tuned till the end because I'll tell you exactly for who this specialty is. Pneumology, aka pulmonology. It's all about the lungs. COPD, asthma, lung cancer, interstitial lung disease, pneumonias, and pleural effusion, this is their field. It's an internal medicine specialty, but with some cool procedures and a strong diagnostic vibe. Let's see how well it scores. But first, a quick disclaimer. This video is based on my experience and the hospital I rotated in. Things might look different elsewhere, so keep that in mind. But still, I did my research and talked to a lot of people. So, what was the structure of my rotation in pulmonology? I had to rotate there for 3 weeks and I shadowed 2 residents, mostly touring the wards, but also going to see patients in the ER, placing pigtail catheters for empyema and pneumothoraxes, and doing consultations, and so much more. During these weeks, I got to see the average life of a resident and a little bit of the attending physician's life. So let's get started. First, work-life balance. Most of my days started at 8 AM and usually I was done around 5 PM consistently. No real surprises or emergencies that made my day explode intensively. Of course, there were some emergencies, but not much if you compare that to other specialties like cardiology or orthopedic surgery. It felt all manageable, the team was paced well, and it rarely felt rushed. Of course, as all internal medicine residents have to, there was still a 24-hour shift every 7 days or so, but I would still score this at 8 out of 10. Predictable hours and enough time in the evening to rest or study a bit more. Second, procedures versus thinking. Pulmonology is definitely more brains than bloody. But to be honest, I was surprised on how many procedures still came up. So here are a few procedures that it includes. Bronchoscopies, which is using a flexible scope to look inside the lungs, and pleural taps, which was draining fluid from the pleural space. For junior residents, the focus was mainly on clinical reasoning, interpreting lung function tests and adjusting meds, and working through tricky differentials. Once residents completed their first 3 years of internal medicine and officially chose pulmonology, they began doing some more hands-on work, mostly pleural taps and bronchoscopy. That said, even for senior residents, the range of procedures is relatively limited compared to other specialties. But the thinking side, well, this is where pulmonology shines, especially with complex cases like interstitial lung disease and unexplained dyspnea, or tearing apart asthma and COPD, and also surprisingly maybe heart failure. That's why I scored this specialty for procedures a 5.5 out of 10 and the thinking an 8 out of 10. Alright, if you're liking this video so far, consider subscribing because I'll be releasing more videos like this. Next, the third thing is patient contact. Pulmonology offers really solid patient contact. You spend a lot of time talking to patients, explaining chronic diseases and guiding them through inhaler use, discussing smoking cessation and helping them understand their condition. Especially in outpatient settings, there is room to build a genuine connection with your patient. On the wards, patients often stayed for several days, which meant that actually you would get to follow them up and see how they improve over time. Something I really appreciated. That being said, there is something that really frustrated me. A lot of patients were smokers. With conditions like COPD and asthma, many of these patients were admitted regularly, and that repetition, especially when it feels preventable, can feel a bit disheartening. Still, Compared to other rotations, I felt that there was more time for each and every patient, and that really made a difference. That's why I scored this specialty a 7.5 out of 10. There is good balance between quantity and quality in interactions. Fourth, teaching environment. My team was super open to teaching, but sometimes the time lacked, and as residents were often very busy on paperwork, nevertheless there was more than enough time for me to learn. You just had to choose your time. We discussed X-rays and CT scans together with the residents, and often they walked me through lung function tests, and I've also got to watch some bronchoscopies. The only downside, during procedures the doctors were often very busy and focused on the procedure, which left no space for questions. But overall, I really felt supported. That's why here they get a 7.5 out of 10. There is a solid structured learning with room for curiosity. 5. Cool factor and the impact. Okay, this one is underrated. It might not feel flashy as cardiology or emergency medicine, but pulmonologists do really make a huge difference. Diagnosing lung cancers early, managing severe asthma attacks, helping people breathe again after months of decline, giving quality back to patients with COPD. There is also a lot of tech involved. Ventilators, CPAP, imaging, which adds on to the cool factor. But still, if you want flashy things like me, this might not be the specialty for you. That's why I give it a 5.5 out of 10 for cool factor. 6 and last, my personal enjoyment. I actually did not expect to enjoy pulmonology as much as I did. It was calm and organized and full of interesting clinical puzzles. I liked how often I got to think but also get to see some procedures, and the patients were genuinely appreciative of my help. The only downside is that it lacked a little bit of adrenaline, so if you thrive on chaos and action, it might feel a little bit too gentle. That's why I give it a 7 out of 10. Overall, pulmonology scores a 7 out of 10. A very balanced, mentally stimulating and patient-centered specialty. Not too intensive, but definitely not boring. But now the big question, is pulmonology something for you? Well, it might be a great fit for you if you are someone like this. If you are analytical, there is a lot of subtle reasoning, test interpretations and diagnostics. Or if you are patient-focused, if you enjoy following patients up, lifestyle counseling and chronic care, this is the specialty you should go for. Or if you are detail-oriented, you'll need to interpret pulmonology function tests, navigate radiology and adjust meds carefully. This specialty might be also something for you if you like calm and steady. Pulmonology is not chaotic, and if you like structure and depths over speed, this could be for you. And last, if you're not procedure hungry. There are procedures though, but they are limited compared to other fields. Now, this specialty might not be for you if you are someone like this. If you are easily frustrated with lifestyle-related illnesses, if you are looking for fast results with drama, or if you want a wide range of procedures. Okay, you're probably choosing between other specialties. Then maybe the video I did about cardiology will interest you as well. So go watch that next.